majority of our physicians are getting their results this way currently. London, talked to them this week. They have 70 physicians live, and they have another 130 physicians coming on in one application later on, or sometime this week. I'm going to give you quite a date. And then here on Perth, kind of the same solution. They've got 55 on. So as we're pushing out electronic charts to the offices, I think we've got the message out there to the physicians saying that there's a lot of efficiencies for the office that can be achieved. So this is, again, one of those things that we said we wanted to start small, think big, and thinking big is what is the next step of information that the hospital can actually send the physician office that will help the hospital and the physician office look after the patients better. So we looked at medication management, and one of the meds, and we'll go back to how a physician actually gets a med. So result. If you look at when a patient comes to the hospital, they have an acute episode, maybe surgery, they leave the family physician's specialty, they come over to the surgical specialty, the surgeon prescribes medications for them, they go through that procedure. On discharge, there's this whole meds reconciliation piece that we need to reconcile the meds that the patient came in, what they were on in the hospital, and what they're being sent home with. Traditionally, that comes out in the physician's dictated note. So the surgeon dictates a note, that the medication list is in that dictated note. That dictated note has to go off to the transcription service. There's ultimately a delay. I mean, that delay can be measured from 24 hours to 2 weeks, depending on transcription backlog, the patient's location, how the physician's getting their results. What we're able to do, or what we believe we're able to do, we know we are able to do it, we just have to get to it and do it. We're able to grab that medication on discharge and send it directly out to the physician's office that second. So saying, using the SPIRE technology and saying, okay, grab that result, grab those medications, send them over to the family physician's office immediately, so that the pharmacist in the family physician office or the physician can review those to make sure they're in line with the medications they would have prescribed at the time. The end result is we're going to see less patients in critical condition or emergence because they're coming back from medication errors. The family physician is going to see less patients making an appointment to see them because their medications got messed up. So this is a complete win-win for both sides, and we basically finished the standard HL7 message that we're looking at for medications this week, and we're looking for a family physician group to try this with. So those standards are creating, but this is using exactly the same technology that we've used going forward. So I'm really excited about that, and want to make sure that that piece will help. Actually, I basically talked about most of that slide, sorry. Should have put two. So, ultimately, starting small, thinking big, we want to look at solutions like this for our total communications. We think there's a huge opportunity, or I think there's a huge opportunity for us to look at personal health records are going to hit us in the next few years. How are we going to communicate with personal health records? This is actually a tool that would do that. If you looked at how we communicate with CCAC, again, this is a tool that we can wrap a little bit of stuff around, that we can have that two-way or multiple-way communication through. So starting back with that one single physician that we started with, on a note in my record, we've been able to build and build and build and build, and it is still kind of the same kind of technology that we put in place a long time ago. So if I was to draw this again, if you remember our first diagram, to draw this again, we could basically, with a little bit of leverage, connect any element of the healthcare system through this communication device back out to any other provider. So seniors residents could send a message, could be converted to an HL7 message, go through SPIRE, go back into any one of the clinics or hospital with some information. A hospital could send stuff out, go back in through the HL7 SPIRE interface, and go back to CCAC. So that is the big picture. That's ultimately what we're trying to work towards. And can't wait to get there because there's lots of gaps and pieces that we need to address. But I just, you know, commend Lynn for moving our Xenos concept out into SPIRE, populating the rest of. We're into some conversations right now where we're going to start to look at joining the communication between those SPIRE projects, so that if a London physician happened to want to send an own sound result, they could do that through the SPIRE project. So huge, I think a huge communication tool, electronic communication tool, which is going to help us out immensely down the road as we all become more electronic.